Hi, and welcome back to the WHY-O-MYO Podcast. This is Janine Steen, your host, hoping to answer your questions about the who, what, where, when, why, and how when it comes to myofunctional therapy. How long is a myofunctional therapy program take to complete? That's usually the first or second question we are asked when we recommend a myofunctional therapy program. So if a patient is being seen for therapy twice a week consistently, and of course we know there'll be a vacation or a sickness or a school concert that you have to miss therapy, but if on a typical basis you're being seen regularly and practicing consistently, therapy should be completed on or about 1 year. Now, there are definitely patients that have finished in under a year, and there are definitely patients that it will take longer than a year. And that is not because they weren't being seen consistently or not practicing consistently, and yes, that will extend their course of treatment, but it may be because we have more goals that we need to target in addition to myofunctional therapy. For example, if a patient is in need of a lingual or labial frenectomy, our first few therapy sessions or our first few myofunctional therapy sessions are strictly designed to work on the prevention of reattachment by scar tissue of that tethered tissue. So if you had a lingual frenectomy, our first few therapy sessions are solely designed to focus on in making sure that you have the maximum range of motion post-lingual frenectomy, that we are not seeing any reattachment or issues secondary to that frenectomy, so that when your frenum, that lingual frenum is completely healed, that we are able to see the full potential or utilize the full potential of the tongue, and the patient is then able to be that much more successful in a myofunctional therapy program. Another reason that a program may be longer than a traditional year-long program may be if a patient has a difficulty following oral motor commands on demand, such as with maybe an oral apraxia or just a traditional auditory processing or language difficulty. Before we can introduce a year-long program of exercises with multiple steps and multiple factors, we need to make sure, or we need to work on improving the patient's ability to follow commands on demand, which is their oral motor planning abilities, or work on their understanding and processing of the directions so that we can execute them correctly so that the patient can be successful with a myofunctional therapy program. If either one of those issues or difficulties or both are not addressed first, then conducting a myofunctional therapy program is next to impossible, because a myofunctional therapy program is a long series of exercises where we're giving oral motor commands on demand, and it also requires the patient's ability to understand and process those directions. So if those two areas are not age appropriate, then we are going to have to address those areas first. Another reason that a patient may take longer to conduct a myo program, complete the myofunctional therapy program, may be if the child or individual has attentional or cognitive deficits or cognitive limitations. Obviously, whether it be the attention to detail or the ability to process and execute too many things in a given session or too many things at one time, we would rather work on 2 goals a session that are going to be done 80% or better than give 5 goals that we can't attend to or can't acquire, so that, and maybe they're only getting it 40% of the time. So in an effort to improve the patient's success, we focus on smaller amounts of activities and smaller amounts of trials in an effort to make sure we're maximizing not only the understanding, but maximizing their success in developing a new motor plan for the subconscious in the future. Another reason that a child or patient may require a longer myofunctional therapy program than 1 year would be if a patient also is in the midst of palate expansion or orthodontia. When a patient is undergoing palate expansion or in orthodontia, or is not in orthodontia or palate expansion at the beginning of therapy, but maybe it happens during or towards the end of therapy, first with a palate expander, we can continue to do myofunctional therapy with a palate expander in, a fixed expander in, as long as we have access to the alveolar ridge or the spot, and as long as we work with the patient and their program, so we modify and alter the way we address the goals and what we're going to target and when, so that we can maximize each session, but also so that the patient will benefit from the additional space that's created as part of palate expansion. However, when the palate expander is eventually removed, we do want to make sure and reestablish any new functions for the resting posture or the swallow, because now that form of the mouth has definitely been altered or changed. So it's not that we are wasting time when a palate expander is in and we're not making progress. It's that we are altering the approach and the way we are handling or sequencing your myofunctional therapy goals, so that we can make the most and benefit from what we have access to when a palate expander is in, and what we want to do and what we have access to when the palate expander is removed. If a patient is in orthodontia during the beginning, during, or towards the end of a myotherapy program, the same thing holds true, in the sense that we are committed to doing their full myofunctional therapy program. However, when they have orthodontics or when they're in orthodontia and it is changing the shape of their mouth, we again want to make sure that the function of their swallow is changing with that form. In addition, we want to work collaboratively with the orthodontist so that they are getting the full benefit of removing that force of the muscle of the tongue off of the bone of the teeth, so that the orthodontia or the braces can do what it needs to do in terms of changing their occlusion and eliminating their malocclusion. Another reason that a myofunctional therapy program may exceed that 1 year mark may also be because a patient has articulation difficulties that are not related to their tongue thrust. And although we will work on many of these issues very early on in the program in hopes to remediating and eliminating the need to extend a program or a myofunctional therapy program, however, if a patient's articulation issues are not secondary to their tongue thrust, then the remainder of their therapy sessions beyond that 1 year mark are truly a traditional articulation approach to therapy. And even though we will make sure we're monitoring and always reassessing their myofunctional therapy goals, the remainder of these sessions are solely geared towards improving their articulation. And I must say this, that I don't ever want someone to say, it's been 12 months and I'm not done yet. As I had said in the beginning of my podcast, 1 year is an average. So we do have patients that finish quicker than that. We do have patients that it takes longer than that. There are all these other factors that will and could, I should say, extend their program. However, the most important part of a myofunctional therapy program is to commit to your treatment twice a week and practice. I cannot say enough that the more you practice, and of course making sure you're practicing correctly, the quicker you will progress, the quicker you will remediate your thrust and any associated symptoms, and the quicker this will become your new subconscious swallow that will no longer interfere with the shape of your mouth, and as well as limit any impact that thrust could have socially, emotionally, or anatomically. I hope I was able to give you some insight and answer some of your questions regarding myofunctional therapy. Please stay tuned and listen to our Myo Minute, and tune in to our Talk the Talk interviews with the many different medical, dental, and rehab professionals as they elaborate or answer your questions and address your concerns directly, especially when it's related to speech-language pathology and myofunctional therapy.